Welcome to the 32nd episode of Vital Questions. As always, I'm your host, Che Guerrero with
La Co-Host.
La Co-Host. Oh, we're starting off our episode with an apology.
Wait, let me put on my special slide. Show on stage. Sorry about the tech issue.
Sorry about the tech issues last week, y'all.
So if you heard our last episode on Venezuela, which I promise I did work so hard on, and I was so heartbroken after the fact. If you heard our last episode, you may have noticed some tech issues that we unfortunately didn't catch beforehand. We did hear it afterwards, but admittedly just found that there was a lot of other important information on there.
Yeah.
So we did leave it up intentionally, hoping that anything on there would be helpful. So if you heard the last episode, hopefully you did. Hopefully you stuck through it. It was another long one also. So apologies on that. We're still trying to figure it out. So if you have any podcast tech tips or StreamYard tips, clearly we need them.
Please send them to us.
Please send them to us and let us know in the comments.
I just hope the conspiracy theories theorists out there weren't like, oh my God, was the episode redacted? Is that why there were like 40-second pauses?
Oh my God, it's so funny. I didn't even think about that. Of course you would.
Nope, we just forgot to add. Anyways.
Yeah, so sorry about that.
And we were thinking with everything going on, and all the bad stuff, we were thinking, you know what? At least we have our health.
Right.
And then we're like, wait a minute.
Or do we?
Which is the title of the episode. At least we have our health, ... Or do we?
Do we? Because, in today's episode, we're covering some news stories that we feel like are good indicators of the state of health in the U.S., at least at the federal level, right? I do want to point out that a lot of health issues are typically handled by state level government. That's why, for example, we have different abortion laws in different states, but we can't underestimate the influence the federal government is having on health in the U.S. So this episode by no means represents the full picture of everything health related. Because unless you guys want me to create a whole, college level course.
It's going to be a 10-part series.
Right, exactly. But these are just kind of picking and choosing a couple of indicators that things may not be the best right now, So when I was putting all this together, I was like, let's start with some good news. Since I actually heard that the House apparently approved the health insurance subsidies extensions under the Affordable Care Act, or ACA, where 17 House Republicans joined Democrats voting in favor of it. But of course, we can't have nice things. So pulling up a Newsweek article entitled "Donald Trump Threatens to Veto Obamacare Subsidies Bill," dated January 12, 2026. The House passed a bill last Thursday, January 8th, that would extend ACA health insurance subsidies for an additional 3 years. The bill, of course, still has to go to the Senate for approval, but many considered it a good sign because 17 House Republicans, like I mentioned, joined House Democrats in favor of the bill, potentially also showing rifts in the Republican Party and showing that certain reps are turning a bit away from Trump's interests. Well, sure enough, here comes Cheeto, because he's like, hey, no, you guys can't celebrate anything. And he says that if the bill does pass through the Senate, he does plan on vetoing it. After Trump said that he would veto the bill, a White House official also told Newsweek, the president has been clear that he believes the money in question should go directly to people to buy their own healthcare rather than to big insurance companies to pad their bottom line. The article goes on to explain that Trump has been floating around the idea of having people use health savings accounts rather than health insurance subsidies to pay for healthcare costs. But again, remember that those savings accounts are typically employer funded, so you need to have a job. Those accounts also typically require the person to have health insurance coverage with a high deductible in order to be eligible, right? So off the rip, they're like, yeah, you can have a spending account so that way you can use money supposedly tax-free. But one, you typically need a job, right? Yeah. And also a lot of people don't realize this, but in order to be eligible for that, the health insurance policy that you have needs to have a high deductible, meaning that you're coming out more out of pocket initially.
Okay.
Right. So you have to meet your deductible, not to go into the boring insurance talk, right?
But I get it.
But it's just the nature of it.
Yeah.
And as Dems have pointed out, HSAs are not sufficient to cover crazy healthcare costs.
No.
Well, yesterday, Trump came out with the Great Healthcare Plan, which was supposed to outline how the government was going to send money to directly out to everyone to help pay for healthcare. But surprise to no one, it didn't actually explain how they were going to do that. So pulling up a CNBC article entitled Trump Unveils Healthcare Plan Outline as Congress Wrestles Over Obamacare Subsidies, dated January 15th, 2026. His plan talked about other things like his arrangements with certain prescription drug manufacturers and other points. And he did mention, oh, we're planning on sending money, but without actually detailing how that process will be, where that money is coming from, how people can use it, nothing, right? The last day to enroll in an ACA plan was actually yesterday, January 5th. Sorry, not January 15th.
15th, yeah.
Lord.
Yesterday, 15th, yeah.
And we still don't have a decision out on the ACA extension. So we'll see how things pan out. But as we've been hearing, especially the last couple of weeks on this issue, ACA subsidies are a huge deal, right? Because if you don't have a job that provides insurance or a job, a lot of these are the public kind of health insurance policies that a lot of people rely on.
Yeah.
And
people's insurance and premiums are going to skyrocket if these subsidies aren't put in place.
Exactly. So it's a little bit of a scary time right now for a lot of people that don't have insurance or had ACA plans and are now not sure what's going to happen.
Right.
So that's a big part of it. And especially when you keep in mind how the job market has been, it just paints a different light as well. Right. So I do think a lot of more people are going to be needing public health insurance like those covered under ACA because this past year, a lot of people, as we know, lost their jobs. So pulling up an NBC News article entitled 2025 was the worst year for hiring since 2020.
Jesus.
December jobs report shows. The article details how the Bureau let's switch to the next one. Sorry. The article details how the Bureau of Labor Statistics reported that only 584,000 jobs were created in 2025. Compare that to the more than 2 million jobs added in each of the prior 2 years. So, Mr.
Wait, say the number again.
2 million jobs added in each of the prior 2 years.
No, but his number.
Oh, his number. Cheeto's number was 584,000 jobs.
In the entire
2025,
year.
correct. I'm honestly surprised that any jobs were created.
I mean, these were jobs that were already kind of flowing
in the
through.
process.
People
Yeah.
were like, I'm opening a restaurant, I'm opening a business, even under these tumultuous times.
Right.
And listen, one of the biggest things that people go into is restaurant business, and with everything going on, people are not really going out like that. So you're going to see this probably even worse next year.
Exactly. And let's not forget the damage that Doge created, right? As we know, Doge went around in early 2025 and started cutting and gutting jobs left and right to the tune of tens of thousands of federal jobs that were cut under the guise of saving money. And of course, as the article shows here, Trump's immigration crusade, as you mentioned, also has negatively impacted the labor market. So things aren't looking great on the insurance side, which is really unfortunate because there's been a bunch of diseases and things that have been spreading.
Yeah.
And also people are dying from preventable situations every day. I don't think people realize that if you can't afford healthcare, that's almost a death sentence for a lot of people.
Yeah.
So like in this case with a 22-year-old in Wisconsin who couldn't afford his inhaler for his asthma after the price skyrocketed and he died within days thereafter. We're looking at an NBC article entitled Parents Sue Over Son's Asthma Death Days After Inhaler Price Soared Without Warning. This is dated back last year, but this is the case of Cole. I don't want to butcher his name, but this is the case of Cole Schmicknecht, who found out that his inhaler, which used to cost less than $70 at his pharmacy, shot up to more than $500 without notice to him. So he had to leave the pharmacy without the inhaler that prevents his asthma attacks from happening. 5 days later, he suffered a severe asthma attack, stopped breathing, collapsed, and he never regained consciousness and then died. The doctors confirmed that his death was due to the asthma attack, which again was very preventable if we had regulations and limits on what pharmaceutical companies can charge for these products. And people go through situations like this regularly because of lack of regulations that, again, rein that in.
These healthcare companies are killing people and they don't care.
They don't. And because again, when you focus, and this is whenever people hear all the dangers of capitalism and why everyone's harping on capitalism, this is a perfect example of the danger of it. This is why people aren't a fan of capitalism, because when you put profits over people, this is what that looks like.
Yeah. This guy was already paying $70 every time he needed an inhaler, and it went up. What is it, like 1,000%?
Yeah, I can't do math. It's not my forte, but 500
overnight.
Yeah,
expecting someone who's already on a fixed budget to be able to pay 2,000% the amount overnight.
Yeah, exactly, and without notice. That's the other problem, right? So you guys already don't have regulations, it seems like, to put limits on pricing. then you allow these companies to make these changes without notice, right? That's insane. And again, there should be some kind of, I don't know, something to be able to rein this in. If you actually care about people, you'll be targeting the people that are setting the prices, that are leading the reason why.
This is how they save money. This is the insurance companies and these pharmaceutical companies. I mean, at the end of the day, it's all about money. Life
Exactly.
does not matter to them.
And
Jesus.
in case you're like, oh, I wonder if that's true. Maybe all pharmaceutical companies aren't that bad. Well, maybe, but a bunch of them are. So for context, there are inhalers, just using inhalers as an example, that are being sold for $640 a month in the US and cost 10 times less in places like Germany, Japan, Canada, France, and the UK. As we see in this letter back in January 2024. This is from Bernie Sanders, the Senate Health, Education, Labor, and Pensions Committee Chair, and several other Democratic senators. They sent to 4 major pharmaceutical companies this notice, including AstraZeneca, as we see here. They were investigating these companies' pricing practices to find out why they are charging such drastically different prices for the same products. So again, we have to remember there are politicians that are trying to regulate this, that are trying to, but we have to be conscious of the efforts of each party and who's actually doing what.
Yeah.
Right.
And a lot of them are just in the pocket of big pharma as well. So that's why I'm not pushing as hard.
Yeah. And if you heard a prior episode, I did mention that Trump apparently has created arrangements with certain pharmaceutical companies to limit their pricing for the next couple of years in exchange, I think, for some kind of, I forget what it was, but in exchange for some kind of investment in those companies. So we'll see what kind of financial benefits come out of those arrangements. And we'll see if they actually trickle down to the people. But I'm going to guess that.
No. Trickle down economy, economics doesn't work.
Yeah, exactly. So that is very high level, on a health insurance kind of standpoint, because that unfortunately kind of rules a lot of what we do. So let's move on to another fun topic: diseases.
What?
So
that's sick. I needed a button that said that.
Just a dork.
Sorry.
So what are some of the diseases that are spreading in the US that you may not have heard of? So the flu, for example. I know you've heard of the flu. And while the flu is nothing new, and while most people can bounce back thereafter, let's remember that children, the elderly, and the immunocompromised are not so lucky sometimes. And that accounts for a lot of people. Even if you're pretty healthy, remember that there's a lot of people that you care about that may fit under these buckets. So we're looking at an ABC News article entitled "Flu Activity Continues to Climb in the US with at least 15 million cases, CDC."
Damn.
Yeah. So as the title shares, there's been at least 15 million flu cases this flu season, along with 180,000 hospitalizations and 7,400 deaths, including 17 children who died from the flu. So it's been a pretty deadly year when it comes to this, so we can't really take this lightly. The last season, for context, a record-breaking 289 children died from the flu since the CDC first started tracking these statistics. And about 90% of those children who died were not vaccinated.
Wait, what? 90% of the kids who died from the flu
last season were not vaccinated, correct?
Is this talking about 2024 or 2025?
This is talking about 2020. The 289 children that died.
Yeah.
This is last season.
Okay.
Right. So last season already 289 children died from that. This season, there's already the 15 million flu cases. And this season already 17 children have died.
Right.
We're not done with flu season.
Right.
Just FYI. We're only in January. So let's remember that. Yeah. And also around the time, currently a total of 42 states are seeing either high or very high levels of flu-like cases. So that's most of the states at this point. A lot of the cases do relate to a new H3N2 variant of the flu, and variants have become another sticking point in a lot of illnesses and diseases because they're morphing, they're mutating.
Right.
And that's the scary part, right? That while we have some medicine that might be helpful for some people now, the more mutations that come out, the more we'll need to have new vaccines or new medicine. And given the climate that we're in, where people apparently no longer believe actual doctors, things aren't looking great.
Yeah, we're also not funding these programs to catch these variants and create vaccines that are resistant to these variants.
Exactly.
So there's a lot of issues going on. The U.S., The U.S. didn't. I don't think the U.S. understood how much it led a lot of this research and a lot of these vaccines that we,
Yeah.
giving Trump the credit in one part, Operation Warp Speed, to create the COVID vaccine. Then he railed against after it came out.
Right.
Do you know what I mean? These are the kind of things that the United States led in, and it's put the whole world in jeopardy because we are not leading in vaccines and in research the way that people were expecting us to, the way people were, believe in us just a year ago.
Right. And that's what's also been messing up the dynamics internationally, right? Like there's this lack of context that people don't take into account, that it's not just us, right? Like we're all interdependent on each other. And I think this past year and this year, I'm sure will further show that. So it is unfortunate. And ironically, we're going to visit that concept later on when we look into why did children's vaccination recommendations recently changed. And that actually ties to Trump instructing officials to look into international standards. And we'll see how maybe that logic didn't make sense. But before we dive into that, let's talk about more diseases, shall we?
Oh, gosh.
So pulling up norovirus, which is also known as winter vomiting disease.
Oh, I didn't know it had such a beautiful name.
Well, it's one everyone throws up all the time. So this has been impacting people, especially in the Midwest and Northeast. I know my brother actually mentioned that he wasn't feeling too great and his entire family kind of hit it. So yeah, not great. But we're looking at a Mayo Clinic article on the norovirus. It is highly contagious and causes sudden and severe bouts of vomiting and diarrhea and all the gross things. And outbreaks are common in crowded indoor settings like schools where there are children and nursing homes with older people, both demographics that can potentially die from this infection. Let's remember. So also pulling up a NBC News article, NBC New York article entitled "Norovirus Cases Driven by Ultra Contagious Variants Are Surging, and Hand Sanitizer Won't Kill It." So friendly reminder, hand sanitizer actually doesn't work against norovirus, which I actually didn't know that.
Wow.
So it's always best to wash your hands, warm water, the whole jazz, right? Here too,
happy birthday, do all that.
Exactly. Here too, a new variant is driving a lot of the newer cases. Last winter, norovirus outbreaks surged to the highest levels since 2012. So again, we're looking at stats that are showing that things are increasing, and people are questioning again, right? Medicine, medical professionals, and it's all tying together in a terrible way.
Sorry, no, I just wanted to just say real quick. Before the election, we were living in a world where Trump officials and all of them were railing against medicine and against facts and all that, and when Trump administration and MAGA 2.0 was just a theory, it was easy to dismiss these things that they were going to do.
Yeah.
But it is unreal that they've come in and destroyed our healthcare system this way.
Exactly.
And our ability to track these diseases that kill our kids.
Yeah. That people aren't aware of the magnitude of what's happening.
That is.
And I think it's under the veil of, well, these diseases have always been around, right? But they haven't been killing people to this extent. And all of these diseases and illnesses and infections and all this stuff are creating new variants. They're morphing, they're mutating.
Yeah.
And we won't get into the fact that that's tied to climate change and higher temperatures, and right? Like everything's, again, tied together. I wish we could go on and talk about all the intersectionalities. But yeah, it's not a joke.
No.
Unfortunately. So for context about how much it's not a joke, every year there are 19 to 21 million illnesses, 109,000 hospitalizations, and 900 deaths from norovirus in the US. And those stats are increasing year after year. Well, actually, sorry, the last couple of years. The virus also spreads in places like cruises, like we see here in this NBC affiliate news article. So in case, you're again, and who goes to cruises? Grandmas. Like, about to have all the abuelas getting all, sick.
The abuelas, the nanas, the titis, whatever you call them.
Yeah. So
they're going to get sick.
This article is entitled "Cruise Ship Out of Florida Hit by Norovirus Outbreak, 94 Affected."
When was this?
This was updated as of January 13, 2026. This is recent. This is now.
Damn, 94 people. Yo, they didn't. First of all, 94 people got norovirus
in one cruise
from Florida.
Yeah.
People just getting the pooping disease. Shh, don't tell nobody. What cruise line was this?
This was, damn, what was it? Holland America line cruise.
Look at them. They're giving the poops. They don't even want you to know. They're hiding the poops from you.
Yeah. Oh, yeah. So this was during its voyage between December 28th and January 9th. So it was through that time span. So this was late last year and early this year.
Wow.
Yeah, but it's things like this that like go again. We know that there's 1.5 million things going a mile a minute, and there's so much information out there. But these are the signs of the times, right? This is not normal.
Yeah.
What's also not normal is, did you know the measles are back?
I'm not even too sure I know what the measles do.
Okay. See what the measles are.
Well, yo, what that measles do? I don't want to find out what that measles do.
Can't deal with you.
So should be the name of our episode. What that measles do?
What that measles? Oh, that would be good. What that measles? That's also what? No, I feel bad. That took a weird turn.
No, sorry. Let's keep going.
So, looking at an ABC News article, we see that South Carolina alone is reporting 124 new measles cases as the outbreak there grows. This article is dated January 13, 2026. Continuing on in the article, South Carolina currently has 434 cases of measles.
Damn.
Just South Carolina.
Damn. Sorry, I didn't.
You just yelled into the
434 cases of measles?
Yeah.
I think that's more than what's happening in Texas.
I was trying to like piecemeal things, but I wouldn't be surprised, to be honest.
No, because there was like a measles outbreak in Texas.
No, there's been
like 2 years ago.
There's been a couple throughout the country.
Well, because people are getting their kids vaccinated less and less.
Correct. And
that's
these
the numbers.
Problem. And last year, the U.S. had the highest number of measles cases since 1992, with a total of 2,144 cases in 44 states. So again, things have been getting worse.
Damn, dude. They didn't even tell us last year. Nobody came out. See, because they're not telling you the truth. We're going to see it later. These people are coming out lying to you, not even telling you that we had the highest record of measles in almost 30 years.
Exactly. And that's the issue, right? We used to rely on our government to share information, to share stats, we used to look to the CDC, we used to look to HHS to actually share verifiable data. Now, we'll get into it later, how we can't unfortunately rely on that anymore.
You know what's something? They used to go, oh, you can't let these immigrants in because they're coming in with all their diseases. You know what's the first thing they make immigrants do at the border?
Get vaccinated. Correct.
You know what's the first thing these people are not doing? Vaccinating their kids.
The white people, you mean?
White people, yeah.
Or not white people.
White citizens. White supremacists, MAGA.
Let's do MAGA.
Let's do MAGA.
Yeah, because that's
what these MAGA people are.
It's not white people.
We're trying to find the right balance.
It's not all white people.
We want the right judgment against people. Anyways. But anyways, yeah.
Where was I? Right, yeah. So
measles. That's
measles.
crazy.
Mad measles.
Mask up. A mask up. Sorry.
And there's worse. So in 2025, again, 93% of the measles cases, 93% of measles cases happened in people who were unvaccinated or their vaccination status was unknown. What they mean by vaccination status is unknown is that people didn't admit to whether or not, and once again, just like the other illnesses, while most people recover relatively quickly after getting measles, this could be potentially fatal for the elderly, kids younger than 5, and the immune compromised, as we see in this Mayo Clinic article about the illness. So, and you were like, oh, what's measles, right? So this
I admit to not know what I don't know.
Yeah, essentially it typically is something that's like not an issue, right? Like I think it's akin to what's it called? Like chicken pox. It's like a skin thing, whatever.
Okay.
Yeah, but it's
if you ever had measles out there, leave it in the comments. Let them know what happened.
Yeah, well,
how did it pop off?
But it is something that was basically eradicated before.
Yeah,
and wasn't around. But now we're seeing more and more numbers as time goes on. So my thing is, I get that these statistics might seem, again, small potatoes compared to the political mess that we're otherwise dealing with. But the concern is that this will be a slow burn, that other variants of these illnesses are stronger and more deadly, could come up. And I don't think everyone is going to necessarily die overnight over some random disease, obviously, unless COVID 2.0.
Yo, you can't even say that without guarantee, because we just lived through a global pandemic that killed millions of people. And back then we had, at least Trump was chipping away at the CDC and the the FDA and all that stuff, but it wasn't the wrecking ball that it is the last year.
Correct. So now we're even in worse circumstances. And
think about this. Trump, when he came into office, he did a lot to get rid of the things that were in place, even during the Obama administration, that they were able to catch. What's that disease that people were just bleeding out all over the place, that everybody was like, oh my God.
Everyone was bleeding out all over.
There was a disease under Obama that people were very afraid that was going to spread. I forgot what it was.
The plague or something?
No, it wasn't the plague. I forgot what it was.
Bleeding out.
But people in the comments will let us know. But anyways, but the thing that we were able to stop it before actually reaching the shores of the US and getting a lot of people was because we had things in place globally that detected when new diseases were coming up and how to like prevent them from getting to us, because there are ways to try to contain it. Trump took away a lot of those guardrails to contain diseases before they hit our shores, which is why when COVID was spreading, I beg to say that COVID was here way before March of 2020.
Absolutely.
But either they were hiding it, or they didn't have the tools in place to be able to know when a disease was hitting our shores. And now we're at a place where the guardrails that were up are destroyed. So right now, okay, measles, these have been around for a while. Yo, we just got COVID 5 years ago. That shit just dropped and it's still doing numbers.
Because I didn't, again, for time's sake, I didn't want to get into it, but COVID is still COVID's still around.
COVID's still putting up numbers.
And it actually is slowly increasing. Not to the extent and the statistics that we saw for the other ones, which is why I focus on that. But COVID is still around and it is increasing. And RSV is something else that obviously very much affects children and is increasing. Didn't want to get into it because of timing, but that's another disease and illness that unfortunately is partially due because people aren't getting their kids vaccinated. And talking about vaccinations, let's get into some of the recent changes. So now that we've gotten a high level view of some of the illnesses, again, not all of them, but these are some that are spreading. Let's look at how some of the personnel and policy changes at the health related government agencies can exacerbate all of this, right? So in terms of personnel, you already know who we have to start out with. The guy driving us straight over a cliff, the tapeworm king himself.
The tapeworm king himself.
Good old RFK Jr. So RFK Jr.
looking like a leather boot.
It's wild. I don't understand how people just exist like that, but it's fine. So let's hear some initial words from good old RFK Jr. of how he views his role as Secretary of HHS and how he thinks people should view his opinions.
What I would say is my opinions about vaccines are irrelevant. I have directed Jay Bhattacharya.
Sure. No, like I said, I don't want to.
So that everybody can make that decision. But I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Right. No, I got that. And I'm not asking you to give them medical advice, but would you vaccinate your child for measles?
If I answer that question directly, that it will seem like I'm giving advice to other people, and I don't want to be doing that. I want people to make.
But that's kind of your jurisdiction because CDC does give advice, right? I'm not trying to do it as a gotcha. It's just
what I think what we're going to try to do is to lay out the pros and cons, the risks and benefits accurately as we understand them. With replicable stuff.
Wow.
Yeah. Wow. So that was Dan's. So this video was from PBS News and is from a hearing last year before the House Appropriations Committee on the Trump administration's budget request for 2026. As you saw in the timing, it goes on and it's not great, but for our time purposes, I'll just leave that little snippet. And he is 1,000% right. We should not be taking medical advice from him because first and foremost, he is not even a doctor. In case people didn't know that, he is not a doctor, and somehow is Secretary of the Department of Health and Human Services.
Well, I mean, it was his years of peddling mis and disinformation online, that brought him to the attention of Trump and all that stuff. And it was him dropping out of the race also that got him that job. So
yeah, exactly. So
oh my God, he won't even answer if he's vaccinated his own kids.
Yeah, he won't say, because the question was, will you vaccinate your children? Would you vaccinate your children against measles?
I don't want to answer that.
And it's like, that's not medical advice. First and foremost, if you had any semblance of a brain, you would know that answering that question of whether or not you yourself would vaccinate children. No, you just know you don't want to be held accountable for anything. That's what it is. And that's what everyone in this administration does. They dodge the question. Again, I think I've mentioned this before in other episodes, but I highly suggest everyone pay attention to the way every single person answers questions in this administration. They never answer anything directly. It's either deflecting, talking about another subject, or beating around the bush, talking about completely irrelevant stuff that is nonsensical every single time. But unfortunately, it's only people that are intelligent enough to understand that see it. And that's what's, But yeah, so he is avoiding, as I said, acknowledging that
he vaccinating those kids.
I mean, obviously. He's avoiding acknowledging that his opinion actually does matter. And unfortunately, he is the secretary of HHS. That's
so crazy. My opinion doesn't matter.
Right. And by their own admission, that's what HHS is for, right? So looking at the Department of Health and Human Services website, the HHS was set up to, quote, enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. So that means that at a minimum, you guys need to know enough to be able to provide these, quote, effective health and human services and to be able to, quote, advance sciences relating to medicine and public health. One would think that you would have to know a little bit about medicine and public health.
No, that's the thing about white men. They don't need to know anything about the job that they're at.
Yeah.
That is,
and yet call other people DEI hires.
And call other people DEI hires because he leads his own life. Because Bobby Kennedy or whatever, is RFK Jr. or whatever, because he works out and he leads his own life. He is the know-it-all of human health services now. Like, ridiculous.
Absolutely. And what's worse is that when I was trying to figure out, like, oh, so what exactly is the secretary's role? Right. Yeah. Is he actually doing his job? Is there a job to do? Ironically,
is there a job for him to do now?
The HHS website doesn't clearly answer what is the role of the secretary. My guess is it probably did before.
That's what I was gonna say. Did it say before what he's supposed to do?
No, it's funny because it just talks about, it gives his background and his bio. We'll pull it up in a second, but it doesn't. So let's look at another government website to potentially give us a little bit of guidance. Right. So pulling up a website page from the Administration for Strategic Preparedness and Response, where we see that the HHS secretary does have the authority to, quote, take action to prepare for and respond to public health and medical emergencies. And then it goes on to describe the different kind of like legal authority that it has over different situations. Okay. So again, at a minimum, you're expected to be qualified to take such actions, right? Like if you're not even a doctor, if you have no real medical experience, how could you possibly be able to determine absolutely anything about a public health emergency? And this is RFK Jr. who's leading HHS right now. In what world would you go to a doctor to get medical advice, to get whatever? My guess is that's probably why he's so stuck on, I don't want to give medical advice.
Yeah.
Then you shouldn't be doing your job. You shouldn't be giving guidance on anything health related. I agree with you.
Yeah.
So resign. Leave.
I agree with you.
Be out.
Yeah. Imagine if somebody came to you and was like, listen, I'm not a lawyer. You shouldn't take my, like, why are you doing in this role?
Literally, imagine someone's like talking out their ass about the law and then being like, oh, but I'm not a lawyer, nor have I ever studied the law.
Then why are you talking to me?
Literally.
Why are you talking to me, bro?
So yeah.
Sorry, just the caucasity. I'm so sorry.
No, it's fine. So let's look at the bio that HHS has on RFK Jr. So again, he's not a doctor. By his own admission in this bio, his whole bio focuses on his work as an environmental lawyer and his work related to environmental efforts. Somehow that means you're qualified to be the secretary of the Department of Health and Human Services.
He knows when oil's getting water. Like,
exactly.
Hey, stop putting your oil in my water. They don't mix. That's all the science he knows.
I don't.
That's all the science he knows.
I don't know how we didn't stop at the brainworm. Like, I don't know how at that point everyone wasn't like, well, maybe he ain't okay up there, and maybe we should stop. Even entertaining the idea of having him in our government.
It's the last name Kennedy. The last name Kennedy goes very far.
Disgusting.
It goes very far.
It's just the fact that was the primary basis of this.
For everybody, it was just the name. It's Trump. Trump's the name.
It's ridiculous.
These people go by name recognition.
Yes.
And that's why you should know the name, vital questions. Tell all your friends.
Tell all your friends.
Tell all your friends.
So because of all this, it's actually insane that the guy who, again, he himself said you shouldn't listen to him for medical advice. But of his own admission. And again, that's, yes, it's his role as secretary is not to necessarily give medical advice in the way that a doctor would. But your role is to give recommendations, to give guidance, to oversee and manage these different health agencies and make sure that what they're putting out actually makes sense to you. And you would be able to do that job if you were at least a doctor.
This is people don't understand. And I think we've gone through this on what an expert is. An expert, and I love this definition more than anything. An expert is someone who can tell you without a reasonable doubt how long something will last or what the outcome would be of something.
Right.
Again, I go back to a plumber.
Right.
If a plumber says I'm an expert and goes, hey, I did something on your toilet and it will last 10 years and it lasts 9 years and 9 months, that's an expert. He got pretty close to it.
Yeah.
RFK Jr. is not an expert.
Correct.
He tells you do these things, you're going to be healthier. In about 5 years, a lot of people are going to be dead. And that is literally the opposite of an expert.
And that's what's heartbreaking about this. But all we can do is warn people. Or we can do is just point out the signs on the wall.
And this is kind of where it scares me too, in my opinion, to say this, that while I believe there are realms where holistic medicine is necessary and we do need a balance between, you know, how people can, you know, eat better, exercise, you know, do the things that requires your mind and your body to be healthier. I believe in that. I do yoga every day. But I also know that if my knee hurts really bad, I gotta go to a doctor.
Right.
And if he tells me, you know, I need the surgery, or I know if I'm really sick, or I know that vaccines help me not get the flu.
Right.
But the problem is that because people are going to be so afraid of the government and health now because of RFK Jr. and the things that he's doing, because they are right to be afraid, it will also make people not want to go to doctors at all. And that also will lead to more deaths.
Right.
If people tend to look for these alternatives that are, that again, it's called snake oil. People selling these people snake oil in a hope like, oh, rub this thing I made at home on your face. And before you know it, all your cancer will be gone. And that's, you know, unfortunately, RFK is scaring people into not wanting to go to doctors.
It's basically a bunch of infomercials that our government is doing right now for these supposed health alternatives that whatever. So yeah, so again, going back, it's insane that we're listening, or anyone listens to this man, because by, again, his own admission, you shouldn't. And he, again, has also been involved with the recent changes to childhood vaccines, and that's what's even more terrifying. So pulling up a summary from the New York Times on Instagram. This is a summary of the different changes in the recommended vaccinations for children. So if we look here, everything that's in red is no longer recommended for all children. So at birth, they no longer recommend hepatitis B or RSV vaccine. So RSV stands for respiratory syncytial virus. I tried, but RSV.
Syncytial?
Right? Syncytial? Y'all know what it is.
RSV sounds like a guy I used to hang out with high school. Me and Syncytial, man, we used to be at the club all the time.
Oh my God. But yeah, so they're at birth, they're no longer recommending these two vaccines. At 1 month, they're not recommending the second dose for hepatitis B. At 2 months, they're no longer recommending rotavirus. Again, even though we talked about, rotavirus is another one of the viruses that has been spreading that, unfortunately, because of time, I couldn't get into, but feel free to look up the stats. And that's another one that's spreading like crazy. 4 months, the second dose of RV is no longer recommended. 6 months, hepatitis B, third dose, no longer recommended. 12 months, hepatitis A, first and second dose, no longer recommended. 11 years, HPV, all of a sudden.
Whoa.
I guess they cured HPV or something, but whatever, even though it still causes cervical cancer in women, but all good. I'm not even going to try. How do you say that? Meningococcal? Meningococcal? Yeah. So the meningococcal vaccine, first and second dose, are also no longer recommended. And most importantly, not most importantly, but pretty important in my opinion, the flu vaccine and COVID-19 vaccine, those annual vaccines are no longer recommended for children. So that's why I wanted to start out with the statistics.
Damn.
Because these are incredibly important changes. And given the stats, and again, feel free to do your own research from credible sources. The stats aren't looking good for a lot of these.
These vaccines have been standard for children for decades.
Correct.
And you come in overnight and just get rid of hepatitis for babies. For babies.
So now you're gonna have even more kids dying because we already went through some of the stats. Kids are dying.
Annual vaccines for all children, and flu and COVID. Damn.
Yeah, it's
and this came out quick. These kinds of guidelines take years.
Yeah.
To perfect and to decide which ones are going to be accurate.
Correct.
This whole giving these kids vaccines in this age range took years of research to create that timeline.
Yep.
And here comes RFK with his ravens to blow it up overnight.
Yeah, and it's not only RFK HHS, it's also, unfortunately, CDC also recently adopted these recommended vaccine changes, which for a lot of people, obviously CDC is your first go-to for recommendations and what to do. Pulling up a HHS press release dated January 5th, 2026, which discussed the CDC accepting these recommended changes. The press release also mentions that, as I mentioned earlier, that Trump directed officials to review child immunization practices of peer-developed countries in making any changes, right? So that was the rationale. The rationale was, well, let's look at what other countries are doing and how many vaccines they're giving their kids. And let's look at like countries in the UK and Europe and ones that are like similar to us. And let's see.
I've heard that debate a lot. So
So what people fail to kind of keep in context is we're not the same countries with the same kind of circumstances, i.e. universal healthcare, i.e. access to actual food, i.e. I don't know, gun laws that don't shoot you up in the street and then, you know, maybe cause you to have some stress and anxiety in life of maybe walking outside of your door. There's a lot of different factors. But again, I'm not an expert, so let's listen to one because I don't like to act like I know what I'm talking about when I don't. So let's listen to two women having a conversation.
You know, a lot of people are saying, hey, this more closely follows European guidelines, which in your view is not necessarily a good thing. You mentioned Denmark, but talk about this comparison and why you're troubled by it.
You know, if we want to adopt Denmark's vaccine schedule, first of all, we can't because our country really looks nothing like Denmark. But then I would argue, can we also please adopt their healthcare system and their gun laws? Why are we picking and choosing what we want to take from Denmark? Our vaccination schedule was built for the healthcare system and the public health and the population and the geography of our country specifically. You know, I hear RFK Jr. and his cronies complaining all the time about how we have so many more vaccines now than we did back in the 70s and 80s. And yes, that is because of medical breakthroughs. That is because of the brilliance of American scientists who have figured out how to prevent diseases that used to kill children at such high rates. You know, if you go back.
So I paused it there just for,
you know,
for
a
time
lot of
purposes.
Yeah.
But obviously that was Katie Couric. I jokingly said two women, but that was Katie Couric interviewing Dr. Annie Andrews about these recommended child vaccination changes. And she points out literally exhibit A of critical thinking. When you think about things in a vacuum, sure, what some asinine people say may make some sense. But when you put things into context, we can't compare apples and oranges.
Yeah.
We are apples. They are oranges.
Yeah.
They have universal health care. They have all these different things that protect their citizens. They have real food. They don't add all these different things that are banned outside of the US. They have all these different circumstances that we're also not adopting.
They're also too stupid to put together climates. The United States is a giant country with very different climates. If you go to Maine, you have a very different climate than Louisiana.
Correct.
So you also need different vaccines to help, because you got to understand, people can go from Louisiana all the way up to Maine, even in the winter, and get a disease that is in the tropics and give it to someone up north.
Right, exactly.
So that's why we have a system to help with also our changing climate in this country alone.
And that's also typically why health decisions and healthcare, like I mentioned in the beginning of the episode, is for the most part left to the states to decide, because to your point,
it's also like a federal. We also need, like, we're also bigger than most countries. That's why Denmark can kind of choose from Denmark, because you don't have, like, you know what I mean? It's a much more, but when a country's much bigger, you need the federal government to at least have some guidelines across the board.
Well, exactly. So that's what I was going to get to, that, like, yes, even though it's left to a lot of this health decisions are left to the states, there does need to be some kind of framework. And again, historically, we've looked to these agencies. We've looked to HHS and CDC
insane.
to help us kind of figure it out, but no. And to add more chaos to the whole vaccine issue, obviously this is putting a wrench in for schools. So pulling up a WHYY article entitled New CDC Vaccine Recommendations at Odds with Pennsylvania, New Jersey School Requirements. This was updated on January 12th, 2026. This is, again, at odds with certain school requirements. This puts the burden on schools and parents to kind of figure it out. Because especially when you have schools that, I don't know, have medical professionals that decide what's going to happen and what the recommendations are and are actually listening to traditional medical guidelines that know what they're talking about, they're going to require vaccination, right?
Yeah.
So then people aren't thinking about the domino effect. Then what? Are parents going to be able to sue schools to be able to allow their children to put their unvaccinated child next to your kid? Hey, people that believe in vaccines, this may happen.
Yeah.
This is the domino effect, right?
And
by doing this, it's now going to cause potential litigation. Now, if you want to protect your kid, what? Now you have to sue. Who are you suing?
Who am I suing?
Because the school can potentially go with whatever the federal government is suggesting and just be like, well, this is the standards. It's totally fine. And then who has authority over what at this point? Whose word kind of dictates everything?
Yeah.
In a regular world, it wouldn't by default necessarily be the federal government, especially for health-related issues. But given how this administration functions, and given how a lot of people are weaponizing our legal system to retaliate against people that aren't in line with the GOP's policies, who knows how people are going to try to weaponize this point.
Oh my God. I think I told you I was driving around and I saw the sticker on a car that said pure blood baby on board. And I think I told you when I saw it, I first thought they meant like the Aryan Nazi pure blood, but they actually was referencing, at least in this point, is that their baby's not vaccinated. And that was their joy, that they've never vaccinated their children.
Jesus.
And I first of all, when I thought it was like white supremacy, I was like, because the bumper sticker said pure blood baby on board of the cars. So first of all, I got mad because I thought it was a white supremacy thing. And I was like, so you think your white baby is better than my babies? Like, how dare you? And then when I knew it was vaccines, I was like, oh, so your dirty baby's going to get my clean baby sick? Get out of here with your dirty babies. You know what I mean?
Dirty baby.
I just got mad at that baby.
No, poor dirty baby.
Poor dirty baby.
It's not your fault your parents are idiots.
So that's that. I might stitch it with the picture if you guys want to see it. Check it out on TikTok. I might clip this and then show the pictures of what I saw when I was driving.
Oh, that'll be good. Yeah. But yeah, so it's having a real domino effect that I don't think people are taking into account. So let's just read a little bit from this article. Vaccines from diseases like hepatitis A and B, rotavirus, RSV, influenza, and meningococcal disease are no longer broadly recommended for all kids at certain ages, according to the January 5th announcement. However, state officials in New Jersey and Pennsylvania say those immunization requirements remain in effect despite recent federal actions, right? So once again, we have another topic and issue that's pinning that the federal government essentially is creating this federal government versus state government situation. And our US system is not meant to be structured that way. It's not supposed to be federal government versus state government. We're all supposed to be working communally together to make our country run. But not. So yeah. So let's get into some of the changes in the CDC. So we talked about HHS and the gremlin that's running it. But unfortunately, the CDC is also part of HHS. In case some people listening didn't know, the CDC, is part of the public health service arm of HHS. The agency is supposed to provide, quote, leadership and direction in prevention and control of diseases and other preventable conditions, and responding to public health emergencies. So yeah, a pretty vital agency to our health, right?
Yeah, they were all over. They were popping on COVID.
I'm saying
CDC guidelines, wear masks, 6 feet,
They were the people.
CDC was dropping a new mixtape every week during the COVID.
Well, let's keep in mind how important it is, because if you remember at the beginning of the Trump administration, it started off with a whole gag order on the CDC.
This year, this 2.0.
Yeah, 2.0. Trump 2.0 starting on 2025, right? So pulling up an NPR article entitled Trump Administration Restricts CDC Research and Messaging with Layers of Oversight. This was last updated on February 14, 2025. After an initial communication freeze that stopped most external communications, like press releases, guidance, social media, scientific reports, etc., the Trump administration installed various loyalists by February to serve as layers of review before information comes out from the CDC. As one CDC official put it, quote, at this point, the administration is controlling what topics may be covered and which may not. So again, for one of our public health agencies that we look to for guidance to be susceptible to the whims of a wannabe dictator who doesn't believe in science or real medicine is terrifying.
Yeah.
Right? Is a problem.
Man, sorry, I just go back to the shock and awe of it all, because we've been focused, and rightly so, on immigration and what he's doing in the States, as far as sending agents. We see what's happening in Minnesota, but but look what he's doing to the States health wise.
Right.
Look what the chaos he's causing within the school systems, and how he's killing people through health. And it's just the amount of death in this man's hand. It is just unreal. The way he kills, the way.
Oh my God. That's a dark ass remix. What the hell?
Hey man. Sorry.
Going to hell, bro.
He's unreal. And I'm the bad one for that. Whatever.
All right. Anyways, so back to this. So also under Trump, the CDC is required to ensure that any communications that now go out are compliant with Trump's executive orders, which, as the article notes towards the bottom of this excerpt we have up on the screen, has led to many publications to be cut from public distribution. Keep in mind that these articles that were cut from public distribution were previously vetted by the CDC's peer review process, i.e. they were vetted by other doctors and people that knew what they're doing and specialists. And they are up to par to the previous CDC standards. But the Trump administration has been explicit that anything the CDC puts out has to be in line with what Trump's executive orders say, which, if we recall the many different flood of executive orders that this man put out, a lot of them are concepts like, it's just there's no rights to transgender people. Yeah. We don't acknowledge gay people. Let's not give women too many rights. Yeah. Let's, there's a lot in there that could be misinterpreted and misused for a lot of damage. And we've, it's just all insane because everything the CDC and HHS puts out, for that matter, should be based on scientific and medical facts and not presidential executive orders, because that shouldn't be guiding health decisions. But, man
who's not a doctor.
Exactly.
Famously not a doctor.
Yeah. And Trump's policies have also been an issue for medical research and related grant funding, since the administration has banned words like women and diversity in grant proposals, including those related to health, as we see in this PBS News article entitled "What Happens to Health Research When, quote, Women and Diversity Are Banned Words." This is dated back March 30th, 2025. So if you recall, last year it came out a basically laundry list of different words that the NIH was told, and a lot of different other organizations were basically informed to not include in their grant proposals, where they request
women.
Right, exactly. Where they request money from the government for medical research that's supposed to help the country. So scientists and researchers and medical professionals were told, hey, don't include words like women and diversity. I think equity was also another word. It was all these concepts that shouldn't be problematic or questionable, and especially in a medical setting, because what's the problem with women and diversity?
I don't know if we get into this, but most of our medicine has been catered to white European men, to be specific.
Well, let me get into
let's get into it.
Not necessarily white European men, but that's context we can add.
Yeah.
But when you also keep in mind that it wasn't until 1987 that the National Institute of Health, NIH, another part of the HHS, put out a policy that encouraged medical researchers to include women and minorities in their research, because they weren't doing that. Again, this was just in 1987. And then in 1993, Congress made it into a law that researchers had to include women and minorities in NIH-funded research. Again, just 1993, they had to make it into a law because people weren't doing it. You start to realize that these policies are an even bigger blow specifically to women and minorities, because we were not included in medical research until the late 1980s to the 1990s.
Yeah.
So to your point, yes, we were not part of the equation. No. And this is why, hey, DEI haters and all this stuff, whatever. Well, you guys, no, it was literally until the 90s that we weren't even a factor.
Sorry that women and people of color want medicine that works for their, their bodies and their the things that they have going on with their communities. Do you know what I mean? We own, this is where there's a lot of studies like this, that most of the things in our world are catered for a European white man, specifically European white man. Like airbags, seat belts, just essentially like, when you go to a restaurant, it's kind of just catered for the height of the bar, for me, like a white man who's like a certain height. Our whole world is catered to that. And one of the biggest issues,
which makes initial sense, right, when you think about like how our world was created, right? Because white men kind of took over and decided everything. And then everyone's just kind of been functioning like that ever since.
That's why we live in an ableist white male society that is catered to them. That's why getting elevators anywhere is, escalators or anything, accessibility is a problem for them. Because like, we can walk. It's like, well, there's still a lot of people who don't. Anyways, and same thing with medicine. I mean, it's just crazy to tell, oh, we're gonna do this research to find out how much Tylenol affects a man. What about a woman? Whatever, you're a woman, just figure it out. That's how medicine was essentially working back then.
Exactly. And that's how we come to that point of like, we're in the late 1980s, early 1990s, and you have to tell researchers, hey, include women and minorities in the stuff that you're looking into, because they're also people. So these aren't the only issues the CDC has been facing under Trump. There's actually been a bunch of other stuff that's been happening. Pulling up an NPR article about these issues that the CDC had back in August 2025, entitled "It's Been a Week of Chaos at the CDC. Here are 5 things to know." This is dated August 29, 2025. So the article goes on to discuss how the previous CDC director, Susan Monarez, was kicked out reportedly after a bad meeting with RFK Jr. and because, according to her lawyers, she refused to rubber stamp unscientific, reckless directives and fire dedicated health experts. Basically, she kind of refused to go to the whims of RFK Jr. And people and reports are saying that that's ultimately why she was fired, because she wasn't taking any crap. And props to you.
I love how he's like, don't listen to me if it's good policy, but if it's bad policy, you better listen to me.
Exactly.
I don't know why I sound like one of the toads from Rocko's Modern Life. Oh, Ed. My RFK voice is just the eggheads or whatever.
It's pretty on point. So the article also talks about how the current CDC director, Jim O'Neill, who replaced Monarez, is also not a physician.
Jesus, what is he? A Subway sandwich maker?
No, well, he of course always supported RFK Jr.'s "Make America Great Again" or "Healthy Again" movement, right?
Healthy again, Maha.
But before serving in his current role as CDC director back in the day, he had various roles at HHS under George W. Bush. Surprise to no one, right? Because that was another kind of inept administration. But since then, between his role under HHS under George W. Bush and his current role back at CDC, he in between has been mostly running the investment funds for billionaire tech investor and friend to the Trump administration, Peter Thiel. So
I didn't know you were gonna say that, but I was like, Peter Thiel, it's an investment fund and all that shit.
So just looking at, in case you're curious where I'm pulling this from, this is right here, the second paragraph. O'Neill previously served various roles at HHS under George W. Bush. Since then, he's mostly run investment funds for billionaire tech investor Peter Thiel. And then whatever, talks about a Senate hearing. And in case you didn't know who Peter Thiel is, he is the guy who co-founded Palantir, i.e. the company who is facilitating a lot of ICE and other government agencies' AI technology and surveillance. So not necessarily the best person. And if you're curious more about Peter Thiel, you may want to check out our episode of What is Palantir? What was it?
What is Palantir?
What is Palantir? That was
Go
the
back
title?
a few episodes. We did a whole episode on Palantir. And Palantir, as long as we get this moment, I don't know if you talked about this a lot, but 404 did a great piece on how apps that were developed by Palantir for ICE are being used to track immigrants, especially when they are gathering. To hypercharge their raids to be able to get more people at once.
So that technology, I think we touched on with Palantir because it was being used for back then. I think that when they were looking for immigrants and to try and tap into devices without a warrant, which that technology is also being hyperly used. But
and this is where, and I saw like somebody break it down how they know who you are, they know your status, they know your background, so they're tracking everywhere you are, and again figuring out when the most amount of people are together that ICE agents can go in and round up people at the same time. And this isn't
That's crazy.
criminals. These are people hanging out. This is
Right.
family getting together.
Right.
When is there a barbecue happening? When is a get together happening? And I say all that to say, looking at you, Romeo Santos, if you ever watch this, you wonder like, oh, you shouldn't get into politics and stuff like that. And artists that are like, oh, I don't want to get involved. Hey, man, these people are tracking your fans to know when they are going to be together.
Mm-hmm.
Don't you think that maybe something like one of your concerts where there's a big group of Latinos might be something they might try to target?
Correct.
So you should really care about what the government is using with this tracking data against your community, because if they gather, they may come at your show.
Or they may choose not to go to your show at all.
Because they're being tracked.
Right. So at a bare minimum, as artists, you ideally should care about your fans. You ideally should care about the community and the culture that helped create your career.
And this is what they're doing to your fans.
Right. But if that doesn't, if you have no heart and that's not what actually, then care about your pockets, right? Because ultimately that's all you care about then, right? So then care about your pockets.
Yo, Palantir is fucking up your pockets, bro.
Realistically, it ain't going to be the white people that's going to be dancing to your bachata. So let's not forget that.
Bachata? I'm sorry. I thought I had that last week at a restaurant.
Yeah.
So we digress.
Correct. So the article, all right, we're going back to the NPR article. All right, so that NPR article, circling back, also goes through the various different kind of chaotic environment that the CDC went through in 2025. So as a reminder, there were massive layoffs by the administration and also subsequent resignations, as we saw with the former director of the CDC, by people who just couldn't ethically continue working under Trump. CDC employees also survived a shooting at the CDC, in case we forgot.
Jesus, yes.
Where a gunman fired 500 rounds of ammunition into the CDC building and a police department. Yeah. And JFK Jr.'s policy shift to solely focus on infectious diseases, which, as we learned earlier when we read the purpose of the CDC, is not the only thing the CDC is supposed to be focused on. It's not only about infectious diseases. And clearly, they haven't been doing a good job on addressing infectious diseases, as we talked about earlier in the episode.
Ironically, they also deal with gun violence.
There you go.
as a public health crisis.
Ridiculous. So I think it's safe to say that unfortunately, the CDC isn't reliable either right now.
Not under this. Not right now.
Yeah. So that's what we have for in terms of government agencies. There's also, of course, the FDA, which is involved in food, right?
Yeah.
And we're going to get into food. I've, in full disclosure, wanted to get into a lot of details about food because food is vital to our health. In case you didn't know, a lot of our health really does stem from what we put into our bodies.
Yep.
As especially people that work out know, you can outrun a bad diet, right? So that's why that's a phrase.
I had to learn.
But what we will talk about is a major food issue that came up recently, and that is the updated food pyramid. Now, some people might be like, well, who cares, right? Like, a lot of people don't even pay attention to that.
You have it up?
No, not yet. So let's just get into it, right? So like food pyramid, this was the original food pyramid. The original USDA food pyramid was introduced in 1992 and provided guidance for a full day's diet. It recommended a larger daily intake of the grain products. That's what we have, this bigger section kind of here in the bottom, right? These are all the grains, and which represented, right, the bottom wider base of the pyramid, and less intake of fats and oils and sugary foods, which is represented by this top part, the tip.
Oh, wow. I didn't know how to read the food pyramid. I'll be real with you. I thought things at the top were like, yo, these are the dopest. And then at the bottom, what?
The reason why I'm looking at you like that is because you're part of the problem.
Well, I mean, I knew you shouldn't be having those fatty things, but I thought the way they at least broke it down was like the best stuff at the top. I thought that's what the pyramid was.
No, it's supposed to be what you like eat the less of. This is why it's less space here. And that's why there's more space here. Yes, admittedly, it usually doesn't say like the percent. Like this is one of the few ones that I saw, not few ones, but this is one of the ones that I've seen that has like 6 to 11 servings, 2 to 4 servings here, 3 to 5, whatever. So yes, I'll give you that, but no.
My bad.
Oh my God. I'm about to make fun of RFK Jr. for that exact same issue. So you're about to.
By the way, I haven't seen this since I was a kid.
Okay.
So when I was a kid, I thought that the pyramid worked that way. Now that I see it as an adult right away, I understand. Oh, okay. But I hadn't seen this since I was a child.
Okay.
And when I was a child, I was like, oh, it works like a pyramid. We got the tippy top. That's the most important.
What? Okay.
You're at the top of the pyramid. It was a kid thing.
No, it's not. It's that's fair because I do think a lot of people had that misconception too, which yes, admittedly, it's something I guess if you always saw this chart that shows you 2 to 3 serving, and it says again here on top, it says fat, oils, and sweets use sparingly, right? Like when you have the actual amounts in there, I guess it makes it clear.
Yeah, because they're the best. So you really gotta make sure you enjoy them.
Oh.
Sorry,
This
that's not
supposed to
what
be the
works. That's
health
not my word.
episode.
I
What are
know.
you doing?
Listen, we're talking about the federal health, not my personal.
Oh, God.
So going back to the federal health. Yeah,
Federal
sorry.
health, yeah.
Sorry, La Co-Host.
So there's been several other U.S. government iterations of suggested dietary guidelines, right? Since this one, the most recent one was actually called My Plate. So this was back in 2011. So My Plate replaced the food pyramid concept. It actually illustrated similar categories, right? As we see here, this plate here, right? And it had like similar categories of fruits, grains, vegetables, protein. It does suggest vegetables more so than the grains, right? So that's like a slight tweak from the last one. And this was actually introduced by our forever FLOTUS First Lady Michelle Obama. So that was My Plate back in 2011. So since then, that has been the general guidance up until the new food pyramid. So let's get into it. So the new food pyramid flips it upside down, right? So it's no longer a pyramid. It's essentially like a upside down triangle. I don't know what we're calling it, but they're still calling it a pyramid.
I'm calling this a clusterfuck because it makes no sense.
Well, right. So like, while I agree that, they keep saying like, oh, we need to eat less processed food for sure. Right. Because processed food has preservatives and all these other things that we know are just issues for our health. So that actually is something that I do agree that this administration has been saying. We need to eat less processed food for sure. And there's certain healthy fats all day. Absolutely. Avocado, olive oil. Those are certain healthy fats that when taken in moderation can actually be really good for you. And if part of a balanced diet, fine. But it is interesting that now protein, i.e. mostly red meat, which is pictured on top, and dairy products and things that have saturated fat like butter and whole milk are now at the top of the upside down pyramid, suggesting that we need to intake more of that, right? So we have whole milk here, butter, all this stuff. And it's a little crazy to have whole milk, dairy, butter on the same kind of plane as fruit, right? So it's suggesting that you should be eating the same amount of butter and fruit, right?
Yeah.
So let's just hear from the gremlin.
I have 4 sticks of butter and 4 bananas every day.
There you go. So let's hear from the gremlin in chief, RFK Jr. himself, on the rationale for the new pyramid.
We've come up with guidelines that are actually going to benefit American health. The prior guidelines were driven not by health interests, but by mercantile interests of the food industry, which had captured FDA. And it was that impulse that drove Fruit Loops to the top of the food pyramid. We've now flipped the food pyramid, and we are urging Americans to eat real food, eat whole foods, meats, and healthy fats like dairy, fruits and vegetables, and whole grains.
Okay. So I'm gonna again adore you, but
me
when he said that's what led to Fruit Loops being on top of the pyramid, he's suggesting that that's what led to past administration suggesting that y'all should be eating more Fruit Loops.
Yeah.
Right. So if we go back,
he said it was influenced by outside forces. Like that's where he was.
That's a separate topic, and I'll get into that. But he's like, oh, that's what led to it being on top of the pyramid. Again, this is the older pyramid.
Oh.
And he's insinuating that that's what led to it being on the top, suggesting that that's what led to it being encouraged to be eaten more often. And that again
he
is not...
knew that most of us didn't know how to read this pyramid. So if we were still going from the childhood mentality, the whimsical mentality that I am so gifted to still have, then you might have been confused and been like, oh, top of the pyramid means is the best. No, it means what you should have the least
of, right? Exactly.
And he is confusing people's perception of what the pyramid is supposed to be.
Correct. Well, he's confused himself.
Yeah.
And
he's confused himself.
That's not something that you also want to be confused about. That's why I was making fun of you.
Oh no.
Yeah, welcome to the realization. But yeah, so to be clear, this original food pyramid was never meant to suggest that you should be eating a lot of sweets, fats, and oils. No. Again, the top of the food pyramid, because it's the smallest section, that's why this is cut up into sections. If you look at it, it's not just a pyramid, there's little sections, right? Is meant to indicate how much to have of said thing every day.
Yeah.
So So he again is claiming, let me just
Yeah,
go in.
yeah.
He's claiming that the new pyramid is healthier for people in the US, that the prior guidelines were driven by mercantile, which again is just his antiquated way of saying business.
Yeah.
Interest, which again, I feel like this administration purposely uses certain verbiage to try and confuse people, which is entirely unnecessary. But mercantile just means business.
Businesses.
The prior guidelines were supposedly driven by business interests of food companies, and he goes on to say the milk is like a healthy fat. Okay. So he also gave another speech on the new guidelines where he added this tidbit. And let's put this up here.
Protein and healthy fats are essential and were wrongly discouraged in prior dietary guidelines. We are ending the war on saturated fats.
Okay.
The only war they've ended this week is the one on saturated fats. Started one with possibly Venezuela.
Yeah.
Greenland.
Yeah.
Trying to start with Iran. But saturated fats.
Gotta go.
We're ending this war.
Gotta go. Which again, I support. I'm all for, again, saturated fats aren't good for you.
Yeah.
But let's just remember there was, if we go back to the original guidance, right? So the original guidance didn't say to not have meat or protein. It's actually right here, right? It had 2 to 3 servings. And right, so like right here, 2 to 3 servings, meat, poultry, fish, all good, right?
Yeah, we there.
And same thing here, even in my plate. My plate had a whole little section on protein, right? So it's not like it was discouraged in the slightest. It was just saying, hey, that shouldn't be most of your plate.
Yeah.
But again, I'm not an expert, so let's look into what the experts are saying. So, pulling up an NPR article entitled RFK Jr.'s New Dietary Guidelines Go All In on Meat and Dairy. This is last updated January 8th, 2026. So a nutrition specialist from Stanford, can we read that? Yeah. A nutrition expert from Stanford University said, I'm very disappointed in the new pyramid that features red meat and saturated fat sources at the very top, because the irony is whole milk and butter, again, are saturated fat sources, even though they're, going against saturated fat. But you included it in your thing. So, so very disappointed in the new pyramid that features red meat and saturated fat sources at the very top, as if that's something to prioritize. It does go against decades and decades of evidence and research. The article goes on to describe how both the American Heart Association and the Academy of Nutrition and Dietetics point to evidence that excess saturated fat is linked to heart disease. And the new guidelines include the same recommended limit of 10% of saturated fat for your daily calories. So they actually didn't even change anything on saturated fat, just FYI. So
the war continues.
Yeah, exactly. So it's all just per usual BS. Other theories about why these changes happened are, of course, monetary. In case you didn't know, the beef, poultry, and dairy industries are big donors to the Republican Party. So pulling up some data from opensecrets.org that lists donor information to political parties. Looking at the breakdown by industry for 2024, we see the difference in what these industries are donating to each party. So let's take a look. So looking at dairy, right? So this line item here, to Democrats, they donated $354,750. To Republicans, they donated $571,250. Drop down to poultry. To Democrats, that industry donated $182,500. To Republicans, they donated $695,500. Drop down to livestock. To Democrats, they donated $209,500. To Republicans, $1,683,800.
Damn, livestock love some red meat.
So I wonder why we have red meat being, suggested, and dairy suggested, and poultry suggested. And again, those are good protein sources. Again, no one's ever said no protein.
Good proteins.
But to harp so much on it and to flip the pyramid on its head and to make it,
and to put it next to things that were already covering those kinds of, nutritional values. Yeah, he talks about the last pyramid was influenced by mercantile, bro.
Well, we're about to get into that. So,
bro.
Talking about there being conflicts of interest with food industry and past nutritional guidance, it actually seems like there's conflicts of interest here. So not just in donations, but even in the new guidance that came out itself. Okay. So let's hear from another content creator who looked at that exact same issue. This is Dr. Andrew Rubin via Instagram, and this is an excerpt of his discussion on this issue.
Okay.
Here you can see and pause to read all the different people that were involved as the scientific review authors, but let's look at some of their conflicts of interest. All right, this author over here received speaker honoraria from the California Dairy Innovation Center for presenting at a dairy innovation conference in February 2025. These two authors here listed that they had financial relationships with the National Cattlemen's Beef Association through honoraria and consulting fees, as well as the National Dairy Council. Here's another author who lists the National Cattlemen Beef Association, General Mills, and American Dairy Science Association.
So the people
that wrote the thing
for the new pyramid.
The people that are authors of these new guidelines, because it's not just the pyramid, they came out with a whole publication about this guidance that goes into kind of like supposedly further details and explanations, right? But within that publication, towards the end of it, there's these acknowledgments of potential conflicts of interest. I believe legally they're supposed to do this for medical and scientific publications, right? So, and it's acknowledgments kind of, oh, these are the writers, and then they go into disclosures. And that's what he's describing.
Wow. That so even in that paper, there's a disclosure like, hey, by the way,
we have affiliations with the beef industry, with the dairy industry, with all these other things, right? So again, admittedly, that is speculation, right? It's speculation in terms of whether, 2 + 2 = 4.
How many of these people who help author this thing actually have medical backgrounds? Or, is it one of these situations?
No. The conflict of interest isn't whether or not they have medical backgrounds. Most of them are PhDs. It's not about that. It's about their connections to these industries.
That's what it's going back to, essentially the cigarette industry.
Yeah.
Where they would get doctors who would vouch for these, studies, these bogus studies that said the cigarette was smoking for you.
Yeah.
Essentially what we have now is that with our food pyramid and all that stuff, like that these are professionals in their field, but they're essentially kooks who would rather give the type of guidelines that help the dairy industry sell more milk.
Exactly.
Yeah.
And there was a trend before this year and before the Maha movement or whatever, towards veganism and vegetarianism and finding animal product substitutes. And
that's why the milk industry was hella mad at Almond for using the word milk. It's like, stop using the word milk.
Right. And if you heard also, remember when Trump came out with the Got Milk ad and all that stuff, right? Where we hadn't seen a Got Milk ad in a while. There's ties to this. And yes, I like to acknowledge that technically this is speculation, technically, right? Because I don't like to say that things are facts when they're not necessarily. But there are a lot of interesting connections with all these different industries and the authors that came out with this guidance, and also the amount of money that's being donated to certain campaigns. And how certain lobbyists are working, right? Like it's all just real interesting.
I mean, did you notice that higher the bidding, the more you got up on the food pyramid? It was VIP. Hey, baby, you want to get to the second tier of this pyramid? I need some livestock money, baby.
Well, to be honest, I wouldn't be surprised, because as we've seen, this administration, you can buy them.
Everything is tiered.
Yeah,
even our food pyramid was tiered.
You can purchase it. You can buy anything in this administration.
The wheat company was just not putting money like that.
Anyway,
grains. Anyways,
imagine just a little thing of green on the side.
I got this for you. I'm not a bird.
So on top of changes to what we're supposed to eat, the updated nutritional guidelines also changed alcohol intake, which is another controversial topic for good reason. So the recommended alcohol intake they changed the recommended alcohol intake by removing the specific daily limits of up to 1 drink a day for women and 2 drinks a day for men, to just saying, as we see here, consume less alcohol for better overall health, which gives you no metric of anything, nothing, right? Like this, it's not really guidelines. It's just saying, hey, don't drink that much alcohol. Which again, there was already limits there. You intentionally remove said limits.
Yeah.
Right. So
and this is insane. It's not even like
that's the guidance.
Shifting the limits, or
that's the guidance.
Hey, do you, baby?
Yeah, it's just saying, like,
do you, baby, is not a healthcare policy.
You, baby,
does not make a healthcare policy.
Correct.
I need guidelines. If I drink 9 beers a day and then I drink 8, oh, look at me, I'm doing better in life.
Exactly. And that's the problem. They're letting regular people, again, with mostly no medical training, most people don't have any, to decide what is, quote, too much alcohol, versus providing at least people a reference of generally speaking, you shouldn't have more than this.
And these guidelines are also in places to, to protect your liver and your heart and all these things.
Exactly.
And what your body can or can't take.
Correct. So let's hear from another completely incapable person, Dr. Oz.
Oh, I was going to guess.
Who Trump appointed as administrator for the Centers for Medicare and Medicaid Services, our poor elderly. Let's hear what he had to say about alcohol consumption.
So alcohol is a social lubricant that brings people together. In the best case scenario, I don't think you should drink alcohol, but it does allow people an excuse to bond and socialize. And there's probably nothing healthier than having a good time with friends in a safe way. If you look at the blue zones, for example, around the world, where people live the longest, alcohol is sometimes part of their diet. Again, small amounts, taken very judiciously, and usually in a celebratory fashion. So there is alcohol on these dietary guidelines, but the implication is don't have it for breakfast. Right? This should be something done a small amount with hopefully some kind of an event that might have alcohol added. But the general move away from 2 glasses of men, 1 glass of women, there was never really good data to support that quantity of alcohol consumption. That data was probably primarily confused with broader data about social connectedness.
Okay. So, yeah, we heard all that. That was the most non-doctor speech I've ever heard in my life. I never thought I would live to hear the day where a doctor's like, hey, have some alcohol. That's totally fine. And with no limits.
It also, and not to give him anything here, but it also felt like as a doctor, he didn't want to say that because he's like,
correct.
A little alcohol and there's a blue zone. And whatever, man. Just he was kind of walking away from his own medical experience.
If you listen to his actual words as qualifiers to all of this, it's in a great world, you shouldn't have any, but alcohol's good. And then he's like,
blue zones where they have a little bit,
where they have some, right? Again, words matter, but it's really important to hear the qualifiers, to hear the some and the a bit and the sometimes and whatever, right? Because they don't want to make blanket statements.
Yeah.
They don't want to apparently give real medical guidance because then they're going to be held to their own words.
Yeah. I actually, just a quick little bit of history. There are studies that show that one of the reasons why men back in you talk about 1492 and those kinds of eras till more recently, why they were so violent, why they were so angry, was because back then alcohol was essentially all they drank all the time.
Yeah.
Mead and all these kinds of alcoholic beverages. There was no real soda. I mean, maybe you had a tea here and there,
right?
But alcohol was what people used all the time. And there are studies that show just the brain, you talk about brain rot through social media. Brain rotting of alcohol every day makes you violent, makes you angry, makes you want to colonize a whole country. Do you know what I mean? And that's why there is a level of, I'm not saying men are better, but there are a level of cognitive abilities are better in men now than they were
before
in the 1800s, and we ain't using it much.
Right.
But what I'm saying is that these things have very deep psychological effects on you that these alcohol companies do not even want you to start studying on.
Well, there actually have been studies, which is why when he says, oh, there's no data to support any of this, there's no data to support that men should not be drinking as much and women should not be drinking as and all that, blah, blah, blah.
Yeah, right.
Of course, you're right. So there was a whole study that was put out on this. So just last January 2025, the outgoing U.S. Surgeon General under Biden put out a whole advisory report talking about the risk of cancer with alcohol. So this report that we have highlighted how even low levels of alcohol use increases the risk of several types of cancer.
Whoa.
Correct. So, and that's just here in the U.S.
Damn, Oz knew.
Of course he knew.
He knew he's sending people. Look, if you want to drink, hey, but you need to know what's happening when you do.
He knows, of course. And if we want to go even bigger, let's look at the World Health Organization. Pulling up their article on alcohol.
Wait, who?
World Health Organization.
I know. Gotcha. I am so immature. I am so sorry, you guys. This is a real show. And World Health Organization.
So the World Health Organization, the WHO, also says that alcohol consumption, even at low levels, can bring health risk. So there's certainly data out there supporting that reducing alcohol consumption is incredibly important for your health. And the Trump administration specifically knows this. How do we know that? Let's pull up this Vox article entitled Dr. Oz claims there's no data to support reducing alcohol consumption. That's not true. This is dated January 9th, 2026. Continuing on in the article, if we scroll down, Vox shares that it previously reported on a study showing the connection between alcohol and cancer, which the Trump administration buried. The Biden administration launched the Alcohol Intake and Health Study back in 2022 to investigate the effects of alcohol in connection with the next dietary guidelines due in 2025, right? These are the new guidelines that came out. So they already had a study that was in place. As soon as the alcohol industry learned about this, they pushed back and lobbied Congress. Congress approved a different study that was overseen by the national academies, but both studies ended up being done. The National Academy study was published and found that the health effects of alcohol were supposedly minimal. However, continuing on in the article, the authors of the National Academy studies themselves said that their study should, quote, not be overinterpreted to justify more drinking or eliminating limits on drinking alcohol. They themselves said, hey, this shouldn't change anything.
Yeah.
The alcohol and health study was never formally published, right? That was the original study that they were looking into. But a draft of the findings was posted in January 2025, shortly before the end of the Biden administration, which provided that, quote, among the U.S. population, the negative health effects of drinking alcohol start at low levels of consumption and begin to increase sharply the more a person drinks, which is exactly the type of evidence that would negate what Dr. Oz said. But of course, the Trump administration never published the final version of this study to the public. So they were aware that there was evidence on this.
Yeah. And when you say, and help me figure something out here, when you say that the links between alcohol and cancer are there, so the health study that the Biden administration put out showed that there is a link.
Yeah, well, to clarify, that health study was never published.
And that's what it is. But once that study sort of came out, the lobbying companies start to move quickly to squash any kind of
No, once they heard that they were even looking into this, that is when they lobbied.
Gotcha.
When they first heard that there was going to be a study done
by
under
the
Biden,
government, yeah,
they lobbied Congress. Yeah. Congress approved a different study, but both of the studies were done. The study by National Academies was the one that said, oh, there's really like no real link, but not the authors themselves, for worry of this exact situation, put out a statement saying this shouldn't change anything. This shouldn't change any recommendations. It shouldn't. But of course, the administration is not going to acknowledge that. Much less acknowledge, hey, in past administrations, there actually is very much data. I don't understand how Dr. Oz still has any kind of medical license, hasn't been, I don't know, censured in some kind of way by the medical, industry, but maybe y'all should look into that.
Yeah.
Because this man is out here causing damage.
Yeah.
So clearly, again, wrong.
Wrong.
So the next question is, why did the Trump administration remove the daily suggested limits on alcohol intake, especially when, as we heard from Dr. Oz, he said, oh, they should be, it shouldn't be too much. Who knows what too much is? But we already were at 1 and 2 drinks. So why did we remove that?
You couldn't drink. But it was at 1 and 2. But drinking too much. Hey man, the limit was 1 and 2.
Right.
What's too much? What's too much? 2 was already too much.
Apparently. So not surprising, I think, to anyone at this point, but the alcohol industry does also donate more to Republicans than they do Democrats. Looking again at Open Secrets, the numbers here to Democrats in the 2023-2024 period, the alcohol industry donated to Democrats $2,420,053. To Republicans, they donated $2,927,069. So technically more, but not drastically so.
Yeah,
right?
You know why this is one of the most down the middle funding I've ever seen from the alcohol. You know why? Because everybody likes to party, baby.
Oh my God, you would.
Everybody likes to party. Everybody like a little something in their cup.
Well, it may also be because this industry was particularly worried because they haven't been doing that great, right? So this is more so what I think is actually happening. I think that the industry is well aware that people aren't drinking as much. Pulling up a Reuters article entitled U.S. Alcohol Consumption at Record Low as Health Concerns Rise, survey finds. This is dated back August 13, 2025. So the latest consumption surveys, which are conducted annually, showed that about 54% of people in the U.S. drink alcohol compared to 58% in 2024 and 62% in 2023. So as time goes on, less and less people have been drinking in the last couple of
I
years.
mean, especially after the pandemic. I mean, I think we drank a lot more during the
that
pandemic.
Also might have been that, right? And a lot of people got just really unhealthy because they were very stationary, weren't moving around a lot. So I think that's also an effect of it, right? This is also less alcohol usage than the previous record low of 55% in 1958. We just beat the record low of 55%.
Yo, way usage. To go. One good piece of news in the US. Y'all getting sober at the worst time. I might add.
The worst time.
When you could really use a drink is when you go.
Don't encourage it.
No, but I'm proud of you. The proudness is even in all these tough times, you're still going, not today, Satan.
The pride.
The pride is beautiful.
So companies are already showing signs of how bad these trends are affecting their profits. Pulling up a Forbes article looking at one entitled, "Is the World Going Sober? 830 million wiped off liquor stocks as Jim Beam halts output." This is dated January 2nd, 2026. The article goes into how Jim Beam is temporarily stopping production out of its main distillery all of 2026.
Whoa.
Yep. This is due to excess inventory and low demand. And yes, this is partially due to people drinking less, as they kind of describe in this bottom section here that we have up. They kind of tie back to the poll that we just described, right? And pull up the similar stats that people are just drinking less.
Mm-hmm.
But ironically, this is not the only reason that Jim Beam specifically was been impacted. Trump's tariffs on Canada is also what negatively impacted Jim Beam.
Dude, you're Jim Beam. I mean, isn't that some of your own self-responsibility? Like, I am Jim Beam.
Well, we're using them as an example.
Kidding,
and
Jim
this
Beam.
is an indicator of the rest of the industry.
I'm kidding,
right?
Yes.
But ironically, Trump's tariffs on Canada is also what negatively impacted him, that company. That 25% tariff on Canadian exports that the U.S. imposed caused Jim Beam and other alcohol suppliers to lose a good chunk of the Canadian market. For Jim Beam, this meant losing 85% of the Canadian market. So meaning they had even less demand and a bunch of supply because obviously they weren't expecting that. And in discussing why people may no longer be drinking, interestingly, the article mentions that Gen Z is generally choosing a non-alcoholic life and leaning more into cannabis or wellness alternatives. And apparently, I didn't know this, but apparently Ozempic, the incredibly popular weight loss drugs, also suppresses alcohol cravings. So there's some, yeah. So because so many people are also on Ozempic, and a side effect is not craving alcohol, they're also considering that that's a possible other reason. But regardless, the alcohol industry has been suffering. And has all the reason in the world to fund and lobby politicians to encourage people to drink more alcohol, even if it's not actually healthy for them. So we do caution everybody when you hear that, oh, well, alcohol is good for social stuff. I mean, I guess, but just be very cautious on potentially drinking more than is actually good for you.
What is insane is seeing these guidelines for alcohol specifically. It's realizing, oh man, even our healthcare system is for sale to a company. It's, hey, you have a crappy product that nobody's buying. Don't worry, we'll hawk it for you.
Right.
We'll hawk 2 of that bitch. Put the stank on and tell everybody to go get meat. That they don't want alcohol that they stopped drinking years ago. So this government is for sale. Even the products you have at home. Don't worry, the next HHS speech will be brought to you by Colgate. They're the ones who are going to buy the next speeches that HHS is going to give you.
Yeah, exactly.
Oh my God.
So like I mentioned in the beginning, I wanted to get into some of the other food things, right? But I didn't want to make this another 3-hour episode, just being conscious of everything. But I did want to flag some stuff. So like, as we know, there's a lot of food that's being sold in the US that is banned elsewhere, right? Things that I found were like corn dogs, there's coffee creamer, there's certain waffles, there's like all these miscellaneous things that are either not being sold because the entire product is just banned, or there's certain additives in it, whether it's coloring, whether it's preservatives, whether it's whatever, right? But we are eating a lot of things here in the US that they're not allowing in other countries. So that is very telling of how our government is not protecting us, right? There was also a story about radioactive shrimp. So
right, remember that?
Yeah, so you might want to look into that. If you didn't hear about radioactive shrimp, go ahead, check me on it. There was, right?
Was
so
there
was a whole recall about radioactive shrimp. And apparently deli ham is now classified as a group 1 carcinogen. Yeah. So
you can't get deli ham without getting cancer.
Well, apparently group 1 isn't necessarily a guarantee to cancer, but it's still like, why are we having carcinogens at the deli? Which is apparently like it. I just can't.
I bet you the amount of rat poop that's available, that's allowed in those restaurants, is going to go up tremendously.
Yeah. And the last news point that I'll leave you all with, that it's not only food and health insurance and all that stuff. Keep in mind that there's a lot of different factors that affect our health, including the environment. Apparently, Trump's EPA, the Environmental Protection Agency, will no longer consider the number of lives saved when setting pollution limits. They're only going to consider the impact on business. So feel free to look into that. And as another example of the fact that this government does not care about you, it only cares about business. So
money.
So that's about it. Everything I have for today's episode. It's, in terms of, at least we have our health. That's questionable right now.
It's questionable.
And if you do have your health, consider yourself lucky and do whatever you can to maintain it.
But check, Europe's health guidelines.
Apparently.
Hey, this was very important. This was very needed. I know, we've been focusing on a lot of big topics, but this was one that I think people kind of dismiss it like, oh, it's fine. I got my health. I got my own thing. But they're doing stuff, to make it very difficult, for the point that when you do, hopefully you don't, but there's a moment in your life where you need some help. There's not a system there to help you.
Right.
They're making you get to that point a lot quicker. And the guidelines to how to keep yourself away from those bad things are not there. So they're really messing with people's physicality in a lot of ways that we're just not aware of it yet, that is not hitting us yet. But it will eventually.
I also, and again, this is probably more conspiracy theory than anything else, but and admittedly speculation, but it is, in my opinion, by design, right? Like, if you think about it, if you create a society that is focused on capitalism, if you create a society where everyone's health insurance is primarily tied to your job, and then if you make people sicker and sicker such that they can't leave said job or have the bandwidth to even look around and to see what's happening because you're so focused and overworked by said job. And then, I don't know, maybe you have some stress and anxiety or some other kind of very real illness that hits you as well. And now you're scared to take a sick day. And then ultimately you may or may not die. And then they will just, it's a revolving door at every company, right? So they'll just fire someone new. So again, that is all a little conspiracy theory, but if you think about it, kind of makes sense.
It makes sense.
But I like to admit when I throw out conspiracy theories. So that one is a conspiracy theory.
Yeah, but it makes it. I get it. But yeah, listen, thank you so much, as always, like a host, for putting this together to give people an idea of, what to be looking out for when it comes to their health. And take time for yourself. There's little mental health breaks I always like to do, but other than that, go to a doctor when you could, while you still can. Hey, anything else for this week?
That's it. I wanted to start. I may start in the next episode a new little end of episode segment, because I do want to leave on a high note since the world is not great.
We'll bring back what made you happy this week.
Yeah, we'll bring back what made you happy, especially since we spend so much time on the internet and people on the internet are actually hilarious.
Yeah,
so a lot of stuff on the internet makes us happy.
Hey, thank you so much. My gosh, another great episode, another great week. We appreciate you guys listening. Please, as always, remember to subscribe wherever you can, wherever you're listening to this. Hit that subscribe button, leave a comment, whatever you can help to boost our what is it called? How people see us online. It'll really help with that visibility. That's the word I'm looking for. Thank you so much.
Sorry,
visibility.
For context, we're filming on Friday, January 16th, and it is 9:53 p.m.
After a long day of research from La Co-Host, so let's not forget that.
And news reporting.
News reporting. Thank you. I appreciate that. Look at the way we respect each other. Always respect people. But thank you so much for listening. Really appreciate you. We'll see you guys next time. Say bye, La Co-Host.
Bye. Thanks for listening.
Bye.